Meaning that's the way Nurse Spencer used to do it.
All I'm saying...
We'll discuss this in the office if you don't mind. Nurse Meadows. I was given the task of running this ward until a suitable candidate could be appointed. It is of no consequence to me that Nurse Spencer allowed you to please yourselves where routine is concerned. It is a children's ward, not a summer camp. We must provide a regime which gives patients a sense of security.
We can, but we don't have to make it look like it's timetable, do we?
I'm not here.
I have instructed you all on 2 occasions that bed-making, TPRs and routine work will be performed at specific times. Most of you have chosen to ignore this instruction, and I'm telling you finally that Nurse Spencer has gone, and all the sloppy habits he accumulated gone with him.
No, just
If there is a repeat of this obstruction of my orders, I shall have no option but to report it to senior nursing personnel. Understand?
And what if something happens like just now? We can't leave Melanie in a wet bed to do TPRs.
Please don't deliberately misinterpret my instructions. Of course, patient care is the priority, but routine is paramount in ensuring both child and parental welfare.
Right, we'd best be off.
I haven't finished.
But me and Mags are late for our breaks.
Breaks are subject to convenience.
Yes, I know, but if we don't take our breaks now, we won't be back in time to do the next round. I am only thinking of routine, Nurse Mitchell.
Thank you for listening. Let's see results. I'm sorry you had to be subjected to that, Dr. Gallagher, but it had to be said.
You're telling me?
I thought for a minute you were going to flatten her cap in there.
Well, I don't operate like that. I think I'd offer to do her hair and then I'd cut the lot off. She looked like a Weetabix when I'd done.
With a face like that, join the club.
Sorry, miles away.
What's new?
Not much.
Only I saw you talking to Dave in the car park.
Well, he's not coming back if that's what you were hoping. I couldn't say that I'd want him to, quite frankly.
Dr. Woods?
Yes?
I've just had some bad news. A really good friend of mine's had, well, an accident.
Oh, I'm sorry to hear that.
He went to casualty a while ago. The thing is, I'm really worried about him, and I just wondered how he was.
You want me to ring them?
Please, but don't say it's me who wants to know.
Oh?
I don't get on with his family. Do I, Sarah?
Not much.
I see. Leave it with me. What name is it?
McCann. Matthew McCann.
Okay.
Do you think she believed you?
She usually does.
Hiya.
What's this for? Claire's going home this evening.
I doubt it. Epigastric pains, general flu symptoms, fatigue, and a dodgy red cell count.
Casualty, please. I want Dr. Jackson. Any clues?
Well, these are her last results, routine ones. They show punctate basophilia. Not exactly 4-star either.
Anemia.
They're all symptoms of lead poisoning. We need to measure the level of lead in her system.
I've seen to that. I'll mark these urgent.
Is this something she's contracted on my ward?
No. It's been building up for a fair period of time.
Hello, Richard. Charlotte here. You had an admission to your ward earlier, I believe. Matthew McCann. I'm afraid your friend is seriously ill. He's having an operation at the moment.
Is he gonna die?
They're doing all they can.
Thanks.
He's so frightened. What if a spider comes up? Why didn't Carl Gamer come up here looking for us?
You can't nail me. I wasn't there when Nail goes down.
Neither was I, but they still went for me. You know what? I'm not a spider is.
Come on.
Ty. Increased transfusion. We'll need more blood if he carries on at this rate. That's better. That's good, Mr. McCann. You can be fine.
Who was it, do you think?
Lob. He'll do anything Sean tells him to, and he's the only one thick enough to carry a knife.
I've seen him go in with a boo, but never a knife.
You never know with him.
Just sprained. I've got to say this to me, doctor. Anyway, What was Sarah Marshall doing up here?
Coming to see Lisa Dixon.
How do you know?
Got skin disease this summer. She came in last week because her arms got covered in scabs.
So, where is she?
In here somewhere.
She didn't give any names, did she?
Says not.
Do you believe her?
Well, the cops are a lot brighter than she is.
Lisa Dixon. It's a skin disease or something like that. I was just wondering what ward you could find her on.
I want a doctor. He needs a doctor now.
Come on. You know, I'd rather play solo. I can't play solo because I need an assistant.
He's homesick.
We all are.
It's all right for you. At least you won't actually know what you're in for.
You try falling under a car. You might know what you're in for, but it don't make you feel any better. Come on, you can't be serious. You're not dying.
How do you know?
Because you don't look like you're dying.
Not now, maybe. But when I go all dizzy and pass out, I think I must be.
Do you believe in God?
People only say that when they think it's really serious.
JJ, will you give us a few minutes and we'd like to talk to James? We've had all your tests back, James.
Oh, yeah.
I've just been explaining to your mum. We're sure now that you have an illness called diabetes.
Have I?
It isn't curable as such. It's something that often affects people for the rest of their life.
How long's that?
Forever.
How long's that? Not long, eh?
Oh, I see, James. You're not going to die from this.
Aren't I?
No, of course not.
JJ thought I was.
James, lots of diabetics live perfectly normal lives. It's simply that your body is short of a chemical called insulin. This deals with sugar in your bloodstream and helps your body to use it for energy. But in your case, the sugar is building up and making you ill. Do you understand? You have to take special care of yourself to make sure you don't get into the same state again, which means you have to completely rethink your diet.
I'm not on a diet.
Well, you are now, and for starters, no sugar.
Not on cereal.
Not on anything.
No chocolate, no jam, no sweets.
Never.
Never.
Dr. Woods, a new admission from casualty.
I'll see you later.
It's not that bad, you know. It doesn't do you any good anyway.
I like sugar. I'm always eating chocolate.
No, you used to. Get it? Unless it's diabetic chocolate, then that's different. Okay?
Is he going to be all right? Believe me, he's safe now. We'll do all we can. He'll be fine now. When did the vomiting start?
This morning. Not just throwing up, it went right over me.
And he's how old?
4 weeks.
He's a big lad for 4 weeks.
Well, 5.5.
Wouldn't care, but Matthew McCann never used to get involved, did he?
That's not true now, though, is it? When the Miggies started calling our estate their territory, it was there all right, shouting with the rest of them. And it was McCann who started that fight in school.